Are you one of the 21 million Americans suffering with life-altering low back pain? In the next few minutes, you will learn about a revolutionary breakthrough in the science of relieving back pain and restoring the quality of life that comes from living pain-free. Back pain is epidemic in America, with an astounding occurrence seen in 8 out of 10 people by age 40. Second only to the common cold, it is the most expensive non-life-threatening ailment seen in doctors' offices across the U.S. and around the world. Current treatments include drugs, surgeries, manipulation physical therapy, and acupuncture. For patients non-responsive to any form of treatment, pain management clinics have become popular to control chronic pain with narcotics. But why hasn't a non-operative procedure been developed as a standard of care for low back pain sufferers? One has, and it is called Lordex. For the next few minutes, we will discuss what causes back pain and tell you about an exciting new procedure that may potentially end your pain and suffering for good. All back pain can be divided into 2 categories: medical and mechanical. Medical includes recent fractures, tumors, infections, or metabolic diseases. Women who are pregnant or in advanced stages of osteoporosis may be included in this group. They represent 3% of all low back pain sufferers. However, 97% of people with acute or chronic back pain have what physicians refer to as mechanical spinal pathology. This means the pain is a byproduct of spinal instability and may result in a disc herniation, degenerative joint disease, sciatica, facet syndrome, and even spinal stenosis. Mechanical back pain may develop from inherited, congenital, or acquired components. Inherited we get from our parents. Congenital we get from birth, such as a short leg or structural anomaly, and acquired from either impact trauma or repetitive stress. Ultimately, as we age, the muscles, tendons, and ligaments undergo wear and tear, weaken, and therefore no longer support the normal lordosis of the lumbar spine. Man walks in the upright position, unlike 4-legged horizontal animals, and only has 2 legs for support. Therefore, the lordotic curve functions to distribute the vertical weight so that no one vertebra carries all of the weight. Over the years, the inherited congenital or acquired changes may allow for a loss of lordosis, producing dysfunction. The dysfunctional spine exists without pain until such a time that a critical mass is reached and the dysfunction exceeds the pain threshold. This is where most people go see their doctor. Medication is prescribed to reduce pain, but does nothing to address the underlying problem of mechanical instability. As the lordosis is lost, the joints move abnormally. The erratic motion in the disc causes a loss of fluid and a decrease in disc height. If the disc forms small fissures, the disc may migrate outward toward the nerve root. Pressure on sensitive nerve fibers from the disc, nerve root, or facet joint may cause a cascade of nerve messages to the brain, putting the muscles into spasm. This cycle is often repeated over days, weeks, months, and eventually for years, until the degenerative changes become visible on X-ray and MRI. Physical therapists, chiropractors, and medical physicians perform a variety of techniques that are done in earnest to reduce pain. If the condition becomes too extreme and the pain intolerable, the back pain sufferer may attempt surgery as a final attempt for a cure. Unfortunately, almost half of all spine surgeries have less than satisfactory outcomes. The procedures developed by the Lordex Corporation in Houston, Texas, were created to become the standard of care for both acute and chronic low back pain sufferers with herniated disc, degenerative joint disease, sciatica, and facet syndromes. Based on the principles researched at major universities and in clinical settings, the Lordex focus was on reestablishing functional capacity and decompressing the sensitive nerve fibers non-operatively, that is, without surgery. A spine surgeon does one of 2 things: decompression laminectomy or fusion to stabilize. These procedures require cutting of the tissue, destruction of support tissue, and the risk of anesthesia, not to mention the high cost of a procedure that has only a 50-50 chance of long-term relief. Lordex approaches the problem exactly the same way, but from a standpoint of a non-operative closed procedure. Surgery is open reduction decompression. Lordex is closed reduction decompression. Surgery is open fusion for stabilization. Lordex is closed stabilization through increased paraspinal muscle strengthening. The proprietary equipment developed by Lordex took 15 years of research to become what is now known in doctors' offices across the country as the Lordex lumbar spine system.